Good afternoon, Mendocino County, and welcome to our COVID-19 Friday update. Today we have with us Dr. Andy Coren, our new Public Health Officer, Carmel Angelo, the County CEO, and Becky Emery, our Department Operations Center Manager. First, we'll hear from Carmel with an update from the county, then we'll move over to Dr. Coren, and then we'll take some live questions from the media. We're also going to try to take a few of your questions today, so leave those in the comments, and we'll try to get to those during the last portion of today's update. With that, I'll turn it over to CEO Carmel Angelo.
Thank you, Sarah, and good afternoon, everyone. This is our Friday COVID update. I think at this point, I would like to call it our Friday County update. So thank you all for joining us. It is my great pleasure today to introduce Dr. Coren to you. I'm sure that all of you have met Dr. Coren. However, he will be sworn in next week. He is our incoming health officer. Dr. Duen is still with us, as you know, and will remain with us throughout this calendar year. So how fortunate are we to have Dr. Duen and Dr. Coren both working with us at this time? And so, with that, I certainly welcome Dr. Coren and thank him for joining us. Before I turn it over to Dr. Coren, a couple things I would like to say. We know that today has been a red letter day, so to speak, within the state because there is a new model that is being used for our 58 counties in the pandemic response, and that is a 4-tiered model. And Mendocino County, of course, is in the 4-tiered model, and we are in a very high tier. And so I will say that it is something that we will have to work to get out of, but the state data is catching up with us. The county data has been accurate. We have been monitoring our data from the start, and we have been working with the state on our data. So we will continue to do so. And it's very challenging moving forward, looking at our data and how we can go about getting our numbers better. And basically what we're trying to do is contain the spread of the virus. I would like to remind everyone that we will be going into Labor Day here shortly. And what we know is when we have holidays, we have gatherings, whether they're family gatherings or friends gatherings. It's really, really important that we maintain our social distancing and we maintain our masking. There is no other effort right now greater than in trying to reduce the spread of this virus within our community. And so it's really important that no matter what you do, that you maintain your masking and your social distancing. So thank you for listening. I would also like to say that over the last few weeks, we've certainly had our challenges with our fires in our region, with helping our neighbors with their fire response. Our county has been very quick and efficient in putting together shelters as needed and not as needed, and just being prepared. With that, I would like to thank our DOC manager, Becky Emery, for all her work in sheltering. She has been our expert over the last few years with putting shelters together quickly. You can always count on Miss Emery to put together a shelter for us. She can do it in her sleep, and sometimes she has. So I want to thank her for her quick efforts in putting together shelters. We know we had a fire this past week in Calpella, and it was Miss Emery that put together those shelters with the schools. So thank you for that. So in response to pandemics, we have been developing shelters as needed and working with our partners to respond to fire. And for those of you that are wondering, our shelters need double the space because our shelters are definitely set up for social distancing, and so that takes more space. So that's what, unfortunately, we'll all see going forward. We know this is the beginning of fire season. We will have more sheltering, most likely more fires are helping our neighbors with fires. Along with that, we have been preparing for public safety power shutoffs, and so I don't want to forget that in talking about this update this week. So if you have any questions or concerns, you can always contact the county. You can still contact the call center, our COVID call center. And at that point, if you have questions regarding public safety power shutoff planning or any response to fires. I also would like to mention, I've mentioned Labor Day and certainly masking and social distancing and watching your gatherings during Labor Day. But I would also like to say we have some unique areas within our 3,510 square miles of county that have greater needs than others. We know all of the problems with broadband. Those problems have only been exacerbated through our recent disasters. We've had issues with cell phone coverage and capacity for our cellular coverage within certain areas. And I would like to say that we are working as best and as quickly as we can with Senator McGuire and with US Cellular and with Supervisor Hasjack and with Sheriff Kendall to be certain that we can assist Covelo with their cell coverage. I would also like to thank Chairman Russ and the Round Valley Tribe for their partnership as we work together in trying to deal with the cell phone issues in Covelo. So I share all of that because that is what we're working on, and certainly any member of the public can call us and get additional information, or certainly share your concerns with us. So since this is not only a Friday county update, particularly this is a COVID update, at this time, I would like to go to our incoming health officer, Dr. Andy Coren, for his comments and his update. Dr. Coren?
Thank you. And I'm very happy to be with you all. I am going to present what I think are some of the most important health issues that we're facing right now. First of which, we had a close call and actually did suffer from some of the fires. We're entering the peak fire season, and we want you all to take note of the fire safety guidelines. Prepare your evacuation plan and exit routes. Pack an emergency go bag with 2 days worth of clothing and toiletries. Consider including a minimal amount of valuable items, possibly a non-replaceable photo or so. Pack 5 days of prescription medications in your go bag. Now, it's important to understand when we face both fire and COVID that they have overlapping symptoms, meaning symptoms can worsen due to that. And in particular, the coughing due to smoke exposure is a very serious issue and is a common way that COVID-19 spreads. Surgical and cloth masks, as many people have said, do not protect completely against the smoke, the fumes, the vapors that come through. However, they do block about 50% of the larger particles that come with smoke. And it's those particles that in many ways cause the coughing. Recently, research from Harvard showed that a micron per cubic meter increase in particulate matter increases the COVID-19 mortality by 8%. So those cloth masks we've been encouraging everybody to use to prevent the spread of COVID are still very important to prevent the spread of COVID and may also decrease your exposure to smoke and the large particles. While we're talking about masks, I really want to make a plug about masks because they are one of the very few but very important protections we have against masks. There are many who are still not wearing the mask consistently in public. Of course, there are some who have valid medical exemptions, and we want them to wear a face shield. But some are also claiming that masks could worsen the risk of COVID-19, and some are, discounting that they can protect you from COVID-19. So what's the science behind this? Research has time and again confirmed the benefits of masks. And recently, as last week, research published in the Journal of American Medical Association showed a dramatic reduction in COVID-19 transmission in hospitals to healthcare workers in their Massachusetts General Hospital system. And this was after social distancing, hand washing, restriction of visitors had already failed to control the soaring numbers. And when universal masking was implemented, including everybody who was in the hospital, you could see in the research publication, the numbers of cases plummeted. It was very, very dramatic. So sure, cloth masks have their drawbacks. We have to wear them because there aren't enough N95 masks to go around. Cloth masks are uncomfortable. They might be annoying for us to have to bring them around with us, and they're also uncomfortable just to wear. But those are small inconveniences compared to the risk that individuals who may have COVID and are not symptomatic can pose to the public. We're still seeing our family members, our friends, and valued members of the community die from this virus. So a simple piece of fabric makes a big statement. I care about your health. If each of us wears a mask, everyone is protected. So we have a campaign here in Mendocino, Mask Up Mendocino campaign, and it's been coordinated by our chambers of commerce and the other companies throughout the county. Our business owners are taking the lead in reminding our patrons of the importance of masking, and we can all support the local business owners by adhering to the order to use facial coverings when in public. And the sooner that we can clamp down on the numbers of new cases, the sooner we can open up our community schools and our community businesses. So we have to focus on the things that we can do now to protect ourselves and the others from this virus. Don't be so distracted by the numbers and the statistics, the interest in cures and future vaccines and herd immunity that you read about in the newspapers. The reality is there are things that we can do now, and masking, social distancing, and hand washing are our primary defenses against COVID-19. So I'm going to move on to the statistics. I know that this usually comes fairly earlier, and I may be too talkative about the other stuff, but let's get into the statistics. And I'm going to give another warning. Let's not get distracted by all the numbers. They help us understand what's happening in our community and how we might intervene to decrease the transmission. But sometimes we see a slight dip in the cases. This doesn't mean we're out of the woods. Case counts ebb and flow constantly. Spikes in cases are always possible. So here are the numbers. The total cases at this point are 659 cases in this county. There are 5 who are hospitalized, but thankfully 0 in the intensive care unit. 200 of our fellow citizens are quarantined at this point. The deaths to date have been 17, the latest being an 82-year-old Hispanic man from the Ukiah area who contracted COVID-19 from a close contact. It can be easy to view this number as 17. That's just not so big as some of the other numbers I quoted, but these are 17 souls in our community who lost their lives. Excuse me. and their families and friends miss them. So we need to think of that. Most of the cases are in the Ukiah area because it's our most populous area. Most cases are due to close contact, contracted through friends and family members. There is actually very few cases who are contracted within the workplace. It might seem harsh that social gatherings have been banned, but this was done in order to protect everyone. Social gatherings are by far the leading cause of the spread of COVID-19. So social gatherings are, you're seeing somebody or a group of people you haven't seen in a while. They're not in your family, they're not in your friends, you don't see them at work. That is potentially mixing the germs that someone in that group may have with people who are otherwise without an illness. The most impacted age group is 19 to 49 years old. Those people who we think of as the strongest in our community, but they can also suffer greatly when they get in contact and they get ill from the virus. And more importantly, the age group is likely to pass the virus on to the most vulnerable. The Hispanic community is being disproportionately affected by this pandemic in our county. And yet the community, the Hispanic community is also the most essential for our economy here in the county. They are the people who are maintaining our buildings and are taking care of the agricultural harvests and so on and so forth. We absolutely need them. We need them in our hospitals, in our clinics, in our supermarkets, and in all the stores. We rely on that community because that community historically has not been advanced because of their being Hispanic. To respond to this issue, we're partnering with our Hispanic community through a task force called the Equality, Diversity, and Inclusion Task Force. And at their suggestion, we developed some educational posters and videos, and we've made a Spanish-only website that is collecting all of the orders and so forth that we are generating. But we need to get those distributed more effectively, and we need to think about how we're doing that and how we're doing case management and case contacting in a culturally sensitive way, so we can help that community decrease the exposure. It's in everyone's interest to decrease the case numbers in that community, so we can and the Anglo community and the Native American community, so we can advance along the governor's plan for opening up the economy and the schools. As far as the state watch list, as CEO Carmel Angelo has said today, Governor Newsom has announced a state plan for tiered stages of reopening. It's very confusing, but I think that they are going to move toward reopening some things a little earlier than what we had planned. We are looking into what it will mean for our community to be in the tiered system, and we'll have more information later in the next week. In fact, the California Department of Public Health hasn't published their final information, and hopefully we'll get their evaluation of our county and where we stand later on today. As far as the schools go, Mendocino County is currently on the monitoring list. The monitoring list will actually go away and become one of those tiers. The schools in the counties on the monitoring list are required to utilize distance learning, but schools can go in the K through 6th grade. They can go through a waiver process to allow in-person learning. And Mendocino County Office of Education, Public Health, and local school districts have worked on this together and continue to do so. And waivers have been submitted to the state. And as of August 21st, there were 10 schools whose waivers had been accepted, and 2 additional schools are working with public health on submitting their waivers. A huge thank you to Senator Mike McGuire, Dr. Dewin, Supervisor Ted Williams, MCOE Superintendent Michelle Hutchins, and our local district superintendents for all your help and hard work to get these waivers submitted to the state. And that concludes the report. I think that we're going to move on towards some questions.
Thank you, Dr. Coren. So first, we have questions submitted by KMUD, Matt Lefevre. The first question is, the CDC guidance regarding testing was in flux this week when they omitted their recommendation regarding testing individuals who came into close contact with a COVID-19 positive person. The CDC website currently reads, you do not necessarily need a test unless you are a vulnerable individual or your healthcare provider or state or local public health officials recommend you take one. California state governor said this guidance would not influence California's testing strategies. Given the conflicting guidance, will Mendocino County adjust its own testing recommendations? And does it take a formal stance on this dispute?
Well, actually, Dr. Dewin's orders for shelter in place that includes testing guidelines includes this. So the people who have symptoms are tested and they're reported, and we do case contact follow-up and tracing. The people who are noted to be close contacts to those cases are the ones that we're talking about now. Those people are contacted, and if indeed they confirm to be close contacts, they're at risk for developing the illness, they're put on quarantine. And the reason for the quarantine is to keep them from spreading the COVID to others in the community. Now, whether they should be tested or not, it doesn't make too much of a difference until day 15. We want to know when they're off of quarantine, is it safe to take them off of quarantine? There is an option to do some testing at day 5 or 6 after they have been in contact with the contact case. However, remember, we are very short of supplies in the testing area. And so we're actually not testing those people at 5 or 6 days consistently. So it was left off. If we need to do it, or if a person develops symptoms, of course, we would test, because then they become a case. So this doesn't affect us all that much.
The next question from KMUD is, this week it was announced that several agricultural laborers tested positive for COVID-19 in Anderson Valley. The nature of agricultural labor often requires congregate settings and the handling of products. What can you tell the Mendocino County public about public health monitoring of the agricultural sectors and best practices that can be utilized to mitigate viral spread amongst this labor pool?
Well, that's a good question. So we are among the ranchers and also the people who are doing the agricultural work, where we have a big educational campaign, and the way that they stop spreading the germs is the same as we all do, which is to wear masks, comply with social distancing, which is 6 feet apart, and a lot of good hygiene. There is, if anybody has a question, there is no evidence that it's being passed through food that they may be harvesting or packaging. That is not something that we think is an issue. If there are people who are getting sick, they should be tested. If they test positive, we'll be doing the contact tracing. Sometimes it is difficult for us to track those people down, but our community partners, the clinics in particular, have helped us locate and talk to people, do the education. And if they need separate housing, we've actually set up separate housing for those people who may not have housing, or they may not have housing that is adequate to separate from the other agricultural workers.
Thank you. Next up is Sarah Reith with KZYX.
Hi, can you hear me?
Yes.
I can. Nice to
Okay.
meet you.
Yeah, thank you for giving this briefing, and I look forward to hearing more from you. To follow up a little bit on Matt's first question, we heard earlier this week that the governor has budgeted a large amount of money for more testing in the state of California, and I'm wondering if we can expect to see some of that here in Mendocino County, and if so, who will administer those tests? I understand that our clinics get a lot of federal money, and I'm wondering if that would place them in some kind of conflict with the CDC and the state guidance.
I'm not sure what you're referring to in terms of conflict. As soon as we get money, we're going to do more testing, because we need to do more testing. I don't know what conflict you're referring to.
Oh, just because the states get federal money, I'm wondering if they would be required to adhere to CDC guidelines and not test certain people, or only test the people they're told to test by the CDC is all.
Well, as I said before, there's not that much of a difference. What the feds said was that there's no need to test people in that midpoint who are in quarantine. We can do it. And if the clinics feel that it's necessary, if we feel that it's necessary, and there's supplies around, I think that would be a strategy that we could adopt. I don't see that would be that would prohibit us from taking advantage of the federal monies.
Okay. And another question about the agricultural workers. I understand that part of the difficulty of keeping track of the people who come down with COVID is that they're traveling between counties. And I'm wondering if there's coordination among the counties where the workers are carrying out their tasks, so that people can figure out who has it and where they are.
Well, one of the advantages of the CalReady and the CalConnect system is that all of the counties can track people going through the counties. And we have good relationships with nearby counties, and that would be information that we would gladly help them with. So yes, it's a potential stumbling block, but that's why we're working together on it.
All right, thank you.
Thank you, Sarah. Next up, Adrian Bowman with the Mendocino Voice.
Hey, Sarah, thank you. Doctor, thanks for being with us today. The first thing is, I just want a tiny clarification on the units you used on something you said. You said, so just let's say this is a clarification, not a full question. You said 1 micron per cubic meter. Maybe I misheard you. Can you elaborate what you mean there? 1 micron of particulates, or 1 micron particulates?
Yeah, an increase of a micron per cubic meter in the particulate in the air will increase the mortality from COVID 8%.
So that's an increase of 1 micron sized particulate per cubic meter.
Yes.
That's an increase in the size of particulates in the air generally from 2.5 to 3.5 on average.
Yeah, or even smaller.
I'm sorry, which one of those is it?
It's whatever particulates. It's the 1 micron per meter.
Okay, sorry. So I'm sorry. I think my internet froze there for a second. So it's an increase in particulates of 1 micron per meter or larger. Is that
right?
Okay.
1 micron per meter is a concentration. So as the concentration of particulates goes up.
Okay. Thank you for that clarification.
Mortality. So there's what the research has shown is that pollution actually does have a detrimental effect on COVID mortality.
Thank you very much for that clarification. So my first official question then is, could you elaborate a little bit on where we might land within the tier system? It looks like tier 1 is. Tier 2 would be 4 to 7 COVID cases per 100,000 per day, and tier 1 would be 7 or more per 100,000 per day. I think the average in the last week was hovering around 9 for the last week.
Yeah, and it's actually,
so does that land us in tier 1, or are there other mitigating circumstances?
When we've done some beginning calculations and trying to figure out what this program is going to be, it lands us pretty high up in tier 1. In other words, we're at a range. We're going to be in the highest risk group, and we're going to have to do an awful lot of work to come back down. They call the highest risk group purple. We're going to have to come down quite a bit to get down to red. There's a lot of work we have ahead of us.
Great. Thank you very much. So I wanted to also ask, and I might be totally incorrect about this. This might also be a question for CEO Angelo, but it had been rumored that one of the people who recently died was a county worker. Is that correct? And could you say what office that might have been in?
I am not aware of it. Becky, do you have any idea? Can you help us with that? No.
I do, but I also see that CEO Angelo has unmuted, so I will defer to her and add as needed.
Great.
So Adrian, we obviously respect all of our 1,200 employees and their families. And when someone within the county family passes away, it affects all of us. So I will say that we have had a death within the county employees, one that we're aware of that was due to COVID. And I really don't know, honestly, what I can say and what I can't say, Adrian. I'm not trying to be cagey with you. We haven't really talked about it out of respect for our county employees, their families, and also the offices. But yes, we have had one death. Yes.
I totally understand your privacy concerns. My follow-up question to that, though, is if you know whether the person contracted the disease in the course of handling their duties at work for the county, and yeah.
Well, let me just give me 60 seconds. Maybe I could kind of answer a question that you might be asking or trying to ask. But So we know that our employee, that there certainly is case investigation that's always done. We don't believe that this employee contacted COVID in the course of their ongoing job, working with other employees or working with members of the public. Regarding that particular office, that office closed for a certain period of time. The office was deep cleaned and all of the employees were tested for COVID-19 more than once. So that was how that was treated. I would say that the department head did an exemplary job in protecting her staff in a very difficult situation, and the office has reopened. We have no reason to believe that that employee contracted COVID at work. And with that, I really feel that that is the most that I can say, Adrian. I hope you understand that. And I would ask Ms. Emery, really at this point, if there's anything she would like to add. This was something that's happened before Dr. Coren is officially taking over, so he does not have this information. But Ms. Emery, I don't know if there's anything I've said that you would like to either correct or add to.
No, CEO Angelo, I believe you've captured the information accurately. I would agree that what I would say is that certainly the office responded immediately and took all of the precautionary steps upon notification of a single positive within their office, and really was very diligent in their response, both in support of their staff as well as the community. And I really appreciate that partnership.
Okay, thank you. And my condolences to your office and the county government for losing somebody. Thank you very much.
Thank you, Adrian. Next up, we have Susan with the Independent Coast Observer. Susan, you can unmute yourself.
Hi, sorry. My internet is kind of wonky today a little bit. And I wasn't sure I heard Dr. Coren correctly when he was talking about the two latest deaths. Did you say that one of them was a 2-year-old?
No. Let's see, am I unmuted? Yes. No. I think it had to do probably with the internet connection. The most recent death that I was talking about was an 82-year-old man.
82-year-old.
Yeah.
Okay. Okay. So there's an 82-year-old man and a county employee are the two latest since Wednesday. There were 15. Now there's 17. Is that correct?
I think the county employee was before I was here, so I'm not quite sure when it was. And but yes, there have been another couple of deaths in the last week. So this has not been a good week for us.
Okay, so the 82-year-old was from Ukiah area?
Yes.
And how about the other person?
I don't have that information in front of me.
Oh, okay. All right, thank you. I had a question also for Becky Emery. I was writing about fires this week, and it occurred to me, I was wondering, is there a phone number people can call if they're evacuees searching for shelter in Mendocino County? Is there I couldn't find anything on the internet on your website, there's something called Office of Emergency Services. That number, it took the person 5 days to get back to me. And when they got back to me, there was no telephone number. So I'm thinking some person just stumbling into the county with no place to stay, that's just gone through the shock of a fire. How can they find out where to go for shelter?
So Susan, we have several. So with the shelters, we have our call center was open, and certainly someone could have called our call center, and that number is 234-6052. We also have updates regularly during disasters. The Sheriff's Department has been very diligent in ensuring that they have regular updates and information on their Facebook page as well, for those individuals that don't have a phone but can get to an internet. We also have regular information when we have large shelters and large incidents that we put out by radio. So we have multiple messaging information that we do put out in incidences. And in each of those, we consistently state where our shelters are located so that individuals in need of sheltering can access those resources.
Thank you.
Absolutely. Thank you.
Last week, I called your number that you gave out. I don't have time to flip through all my notes, but I don't know if it was the call center, but I called to find out what would happen if someone who was a strictly Spanish speaker called and the person didn't know the answer and promised to get back to me and has not gotten back to me. So I was curious, do you have Spanish speakers at these call centers?
We
Yes.
do indeed. And so I apologize that someone didn't respond to you, but we do have a bilingual staff person on throughout the call center shifts.
Okay, interesting. Thank you.
Thank you, Susan. So we're going to go now to our viewers live on Facebook, and we have a few questions from them. I'm going to start with one that I'm seeing quite a few times. With the governor making the announcement to the tiered system in Mendocino County being placed on the purple, people are wondering, what does this new tier system mean to us? It looks like things like salons or barbershops might be able to open with modifications. When should we expect a new order based on like the new allowable activities for the tiers?
Well, these orders from the governor are very complex. I've been on 3 calls in the last 2 days with the California Department of Public Health, and they didn't even have clear answers how we could figure out which level we're on. We have done our own spreadsheet on the basis of our numbers, and yes, we're pretty far out there on the in the purple zone, tier 1, meaning we're going to be the most restricted. It's not really going to affect much of what we do in the next week. However, I think that hair salons and barbershops will probably be the first able to open.
Thank you. I'll just briefly add, we will post more information later this afternoon. Like Dr. Coren said, they're reviewing this new information from the state. And so we'll have more information on upcoming orders and changes. And I see CEO Angelo unmuted. Would you like to add something to that?
Yeah, Sarah, thank you very much. I just want to say that that Mendocino County has allocated additional dollars to West Company to work with our business community. And I hope that that the listening public and the media is well aware of West Company. They are our economic arm for Mendocino County, and they have done a lot of work with Dr. Doohan and will be doing work with Dr. Coren to be the intersection between the business community and public health, and to assist us in working with the business community. So we have allocated additional dollars. West Company will be putting out guidelines for that money to the business community. For example, those small businesses, 1 or 2 people, in a business or a single person owned business. We're looking at trying to assist them as best we can. I also want to say, as Dr. Coren has talked about, while we're looking at the state allowing hair salons to reopen, we do know that that doesn't include nail salons, and it does not include nail salons, and it does not include personal services. So we have a long way to go before some of our single person owned small businesses actually are able to be up and running and able to support themselves again. With that, we are looking at models, best practices throughout Mendocino County and other counties for some of these businesses. And one of the models that we talked about at other Friday updates, I would like to bring this model back because I think it is an example of a creative collaboration between a large business and a small business. And this is Ravino, that has been working with one of the nail salons and is allowing the nail salon employees to do pedicures outside at Ravino in the vineyard. And I think this is an example of a very creative effort, and also an effort of a large business helping a small business. And these businesses, these nail salons, these hair salons, personal services with one person supporting themselves is very, very difficult for these business owners to continue. So I would like to commend this vineyard for the work that they're doing, and again, use that as an example for our larger businesses to assist our smaller businesses in trying to stay afloat and keep moving forward. And again, be looking for information coming out from West Company. We have allocated additional dollars to West Company to work with our small business. Thank you, Sarah.
Our next question is around N95 masks. So we've been through fire seasons many times, and often when the air quality is really bad, it's recommended to use an N95 mask. So when should you be wearing an N95 mask due to poor air quality?
Well, at this point, we are prioritizing having the healthcare workers who are in constant contact with the COVID germs use N95. And we're struggling to have enough of those medical masks and N95 masks to cover the needs in our healthcare centers. As far as, outside because of fires, the people who are at the highest risk, people with lung disease, people with asthma, heart disease, if they can get their hands on it through a pharmacy or a hardware store, when the pollution is high enough, they should start using it. And the air quality board that we have has published some recommendations around that, and that's online.
Thank you, Dr. Coren. This next question, it may also be for you, Becky Emery, and for you, Dr. Coren. It's kind of a two-part. Do we expect that evacuations will impact COVID numbers and possibly cause a spike in cases? And is there any correlation between a decrease in testing in fire areas?
Well, I would say that it poses a threat for an increase in cases when we have to bring people together. But Becky has created shelters with sufficient precautions to decrease that threat and hold it as low as possible. Becky, do you want to answer more about that?
Certainly. So in our shelter system, we have a dual check-in. We are working to ensure that we are doing not only the health checks for individuals of symptoms and making sure that individuals that are checking into the shelter are not currently in isolation or quarantine. For those individuals, we would be rerouting them to our alternate care site to provide support so that we're not mixing our populations. And then also, as I said, we're doing the same checks that we know that many of our businesses are doing, that we're doing here in our operations centers regarding temperature checks and symptoms, and having those conversations with the individuals as they're checking in. We have, as was stated previously, increased the spacing within our shelters with significant radius around each of the sleeping areas and each cot. and are continuing to ensure that we have safety measures in place, and we'll be doing regular checks should we have to open a shelter for an extended period of time. If I can, Sarah, I'd like to go back to one of your prior questions regarding the tiers and the orders and when information will be coming out. I know that we have been working very diligently to support Dr. Coren in his first week with us. And so with that, Dr. Doohan has been still providing supports to Mendocino County. And with that, she has been working on additional orders that I believe she's hoping to be able to put out today that cover some of the information in the new tiers. So certainly I believe there will be more information coming. It's a great partnership with this team to be able to onboard with Dr. Coren and still have Dr. Doohan's support. So we've divided some of those duties. So I just wanted everybody to understand where we're at in this process, and that we certainly want to be transparent and be able to provide as much information as possible with our community. And so with that, we will have that as soon as possible.
Thank you, Becky. And we'll be sure to post that information about new orders and when they become effective here on Facebook as well as our website. We have another question about the schools. 10 schools with waivers accepted. Which schools? So we do have accepted waivers for 10 of them. We have the full list on our website, mendocinocounty.org/COVID-19. Under our FAQs, we have a whole section with FAQs on the schools, and the 10 current schools are listed, and we're continuing to work with other school districts that are interested in the waiver process. And I'll let Dr. Coren, if you have anything to add for the schools.
No, at this point, I don't have the names of the schools on the top of my head. I can say that the waiver process, the problems with statistics being reported to the state through CalReady. And so initially we did not think that they were going to need to do waivers. And then they did have to do waivers, and it was retroactive. So everybody had to really hustle last week to get the waivers in. And thanks to all the superintendents of schools and the county superintendent and so forth, everybody working together to get that through. It was very difficult. And we're going to try and keep, working together with our partners to make sure we can do everything that we used to do, but we want to make sure that everybody knows the restrictions are to guard the health of our county. That's the only reason for it.
Our next question is, are there plans to test the sewage in Mendocino Village? And when will antibody testing be available in Mendocino County?
I am not aware of testing sewage anywhere at this point, and the antibody testing is not available at this point.
I would suggest that you check with your local utility provider. I know that there has been different municipalities that operate a sewer system or special districts that operate a sewer system that have tested. So I encourage you to check with your local sewage provider. The next question we have. Will N95 masks be made readily available for Mendocino County community members? I think we briefly touched on that. They are being prioritized for the medical community. I know that many residents do have N95s in their go bags for fire, and those could potentially be used with severe air quality. We have just going through to see if we have any more questions here today. Here we go. The county dashboard contains daily updates in terms of counts and daily snapshots. Is anyone in Mendocino County Health System tracking any growth metrics on the number of cases, for example, doubling periods or percent growth, positive or negative? It would seem that if we track growth metrics, we could set and track measurable goals that relate to timing reopening. So if Becky and Dr. Coren want to talk about the other types of metrics that we do track.
There are a lot of metrics, and the doubling time certainly is one that historically has been used. I think we're getting some of that information. I don't know what it is right now, but whatever metrics we have, we're trying to put it to good use to figure out how to control this.
So if I would add, Sarah, we are tracking a significant number of metrics. You may note that we posted our EPI tracker this week, showing the number of cases per day from the date someone has tested. So that is continually changing as we move through and receive test results. Additionally, all of the data points that are in our testing, our attestation, are being tracked regularly, which includes the doubling time, average daily new cases, the percent of hospitalizations and intensive care unit percentages, percent of cases over 60 years of age. So there's a significant number of data points that we are tracking. We are working in coordination with the city of Ukiah as well on geomapping to be able to identify hotspots and areas where we can do focused outreach. And so we absolutely agree, the more data and information that we have, the stronger we are in our ability to respond to this pandemic.
Is there any correlation between fires and decrease in testing?
Not that I know of. I mean, we're having problems with testing all over the county because of the availability of tests and reagents. If the fires affect that or our ability to receive or store the reagents, the materials, that would definitely impact our ability to test. Becky, do you know any more about that? No.
I think we have time for maybe one or two questions. I see one question here. Is the county still urging the state to open up state parks to full capacity?
I don't have any information.
Yeah, I'll go ahead and take that one. Yes. Quick answer. Yes. We put in a mutual aid request to open up Manchester. And we're also working with Senator McGuire, who is our biggest champion. Thank you.
All right, I think that covers most of our questions for today. I just want to remind the public that later this afternoon, we'll be posting a recap of our COVID-19 update in English and Spanish. For those of you that joined us late, you can watch the replay here on Facebook or on our YouTube channel. We are working on new orders to be in line with the new information from the state. So look back later this afternoon or evening for information on orders and when they become effective. For more information on the school waiver process or school orders, those are all on our website under the Health Officer Order page. With that, I want to thank Dr. Andy Coren for joining us, CEO Carmel Angelo, our Department Operations Center Manager Becky Emery, and our media. We will see you again next week. Have a wonderful afternoon and a good weekend, and we'll see you soon.